What is a septoplasty turbinate reduction? So a septoplasty is a surgery in which we straighten up the divider between the two sides of your nose. This is inside your nose and it's not something you can see from the outside. If you have nasal obstruction that is always on one side, you may have a doctor that looks in there and says, oh, your septum is deviated. That means that divider inside that's made of cartilage and bone is bent over to one side. So in a septoplasty, we straighten that up so it's more in the midline so you have more space on both sides to be able to breathe. First of all, what is a turbinate? So turbinates are structures on the inside of the nose. They look kind of like a hot dog and they shrink and swell to heat and humidify the air. If these are swollen because you have allergies, you live in a place like Houston that has a lot of irritants in the air, or yours just happen to be big, these can be something that can take up space inside your nose and make it hard to breathe. So in a turbinate reduction, we physically shrink down the turbinates so you make them smaller so you have more space in your nasal airway to breathe. These are often done together because they both can help you breathe better. And then also, if your septum is really, really deviated over to one side, your turbinate on the other side will swell, and we call it compensatory hypertrophy. So it's trying to take up that space, knowing that your body needs something in that space. And so that side will be really big, and if you just put the septum back in the midline and didn't fix that, then your side that was your good side becomes your bad side because that turbinate is so big. So a lot of times we'll do them at the same time, do the septoplasty to straighten your septum, and then do the turbinate reductions to shrink them down. Both of those can help you breathe better, and the downtime is about the same for both of them. How is a septoplasty and turbinate reduction done? A septoplasty and turbinate reduction are done inside the nose. There's no external incisions. The septoplasty, we make an incision inside where the mucosa is, or the covering of the cartilage and the bone that makes up your septum. And then we reshape that cartilage and bone to make it more straight and in the midline. With the turbinates, there's a lot of different ways to reduce turbinates. Talk to your doctor to see the way that they do it. You can physically take out a little piece of that turbinate so it's physically smaller. You can take out a little sliver at the bottom of that turbinate. You can reduce it with radio frequency. You can use a microdebrider. There's so many different ways now that you can do it. And so find out what your doctor does and how they do it and what the efficacy has been for them with that way. I personally take out a little piece of the turbinate. It looks like almost a piece of pie at the bottom, and so you bring the edges together, and so that turbinate is physically smaller, and that has been the way that I've found has the best efficacy for my patients. How long does it take to recover from a turbinate reduction? Luckily, this is a really quick recovery. You feel pretty good that night, that evening, and the next day you could probably go to work. The only downtime you may have is you may have some stuffiness just from the swelling on the inside of the nose where the procedure was done, and then you may have some dripping. So your nose may run a little bit more than what it normally does, and you can have some blood mixed with the mucus, and that's totally normal the first few days. So if you did it on a Friday, you should be able to go back to work on Monday if everything goes well. Have questions? Call or email anytime. I help patients like you every day. I'd love to talk and understand what you would like to achieve. Thanks for watching.